Welcome to Health Turn. Subscribe my channel and click bell icon to get notifications about new health videos. Iron-deficiency anemia is a medical condition where the body lacks sufficient iron to produce enough hemoglobin, a protein in red blood cells that carries oxygen to the body's tissues. It is one of the most common nutritional disorders in the world and affects people of all ages and genders. Iron-deficiency anemia is usually caused by a lack of iron in the diet, blood loss, or an inability of the body to absorb iron. Some common causes include dietary deficiency. One of the most common causes of iron-deficiency anemia is a lack of iron in the diet. Iron is found in many foods, including red meat, poultry, fish, beans, and fortified cereals. If you do not consume enough of these foods, you may develop anemia. Blood loss, whether it is due to heavy menstrual periods, injury, surgery, or another cause, can also lead to iron-deficiency anemia. The loss of blood depletes the body's iron stores, leading to a shortage of red blood cells. Poor iron absorption. Some people may have difficulty absorbing iron from the foods they eat, which can lead to anemia. This can be due to certain medical conditions, such as celiac disease or Crohn's disease, that affect the intestinal tract's ability to absorb nutrients. Pregnancy and childbirth. Pregnant women and women who have recently given birth are at increased risk of developing iron-deficiency anemia due to the increased demand for iron during pregnancy and the loss of blood during childbirth. Chronic illness, such as kidney disease or cancer, can lead to iron-deficiency anemia. This is because these illnesses can cause chronic inflammation and increase the body's demand for iron. Medications. Certain medications, such as antacids and nonsteroidal anti-inflammatory drugs, NSAIDs, can interfere with the body's ability to absorb iron, leading to anemia. The symptoms of iron-deficiency anemia can vary from mild to severe, and they include fatigue and weakness. One of the most common symptoms of iron-deficiency anemia is fatigue and weakness. This occurs because the body does not have enough red blood cells to carry oxygen to the muscles and other tissues, leading to feelings of exhaustion. Shortness of breath, especially with physical activity, can be a symptom of iron-deficiency anemia. This is because the body does not have enough oxygen to meet its needs, causing you to gasp for air. Rapid or irregular heartbeat. Anemia can cause an irregular heartbeat or a rapid heartbeat. This is because the heart has to work harder to pump blood through the body when there is a shortage of red blood cells. Pale skin. Iron-deficiency anemia can cause the skin to look pale or yellowish, which is due to the lack of red blood cells. Dizziness or lightheadedness. Dizziness or lightheadedness can also be a symptom of iron-deficiency anemia, as the body does not have enough oxygen to reach the brain. Cold hands and feet. People with anemia often have cold hands and feet because the body is not able to properly regulate its temperature. Brittle nails. Brittle or spoon-shaped nails can also be a sign of iron-deficiency anemia. Headaches. Headaches can also be a symptom of iron-deficiency anemia, as the lack of oxygen to the brain can cause headaches. It's important to note that these symptoms can be caused by other factors as well, so it is best to consult with a doctor for a proper diagnosis. Treatment of iron-deficiency anemia. The treatment of iron-deficiency anemia depends on the underlying cause of the condition. Some common treatments include dietary changes. Increasing your intake of iron-rich foods, such as red meat, poultry, fish, beans, and fortified cereals, can help replenish the iron stores in your body and improve symptoms of iron-deficiency anemia. Your healthcare provider may also recommend taking iron supplements to help increase your iron levels. Iron supplements, such as oral iron tablets, are a common treatment for iron-deficiency anemia. They are available over the counter or by prescription. It is important to follow the instructions of your healthcare provider when taking iron supplements and to avoid taking more than the recommended dose. Intravenous, 4, iron. In some cases, your healthcare provider may recommend intravenous, 4, iron therapy. This involves administering iron through a vein in your arm. 4 iron therapy is usually recommended for people with severe anemia who are unable to take oral iron supplements. Blood transfusions. In severe cases of iron-deficiency anemia, A blood transfusion may be necessary to quickly increase the number of red blood cells in the body. Blood transfusions are usually only recommended in severe cases, such as if you are experiencing symptoms of heart failure or other complications. Treating the underlying cause. In some cases, iron-deficiency anemia is caused by a medical condition, such as heavy menstrual periods or gastrointestinal bleeding. Treating the underlying condition is important for addressing the root cause of the anemia and improving symptoms. It is important to note that the specific treatment for iron-deficiency anemia will depend on the individual and the severity of their condition. Your healthcare provider can help you determine the best course of treatment for your individual needs. If you found this video informative, click the like button, comment, and subscribe to my channel for more health videos.